do have a quorum. It is noon. That's so. First item is approval of the minutes. Any additions or corrections?
Move for approval.
None? Second?
Second.
All in favor? Aye. Opposed? Minutes are approved. Health officers report?
All right. It's hot outside. Some of you may have noticed that. There are various resources for beating the heat, most of which include drinking water and staying near air conditioning. The tick season is in full swing, and in the past 5 years, Wayne County's had 4 cases of Lyme disease, and they've had, we've got 2 cases that are being investigated now. This is a disease that first made its appearance in Connecticut years ago and has gradually migrated its way westward. So I think it's, we need to, for ourselves, and need to warn our patients to be careful out in the woods, spray your ankles with off or any kind of tick repellent. Check your body for ticks when you're taking a shower. We've tested ticks in Wayne County. The nymphs that were tested, 13% were positive for Lyme disease, and the adults were 14%. In the state, the nymph positivity is about the same, but the adult tick positivity for the whole state was around a third. We also tested for anaplasmosis, babesiosis, Ehrlichia murus, oclarensis, and hard tick relaxing fever positivity. Dan helped me learn to pronounce each of these terms prior to the health officer report.
Very well done.
I want to give him full credit for that. We've got, we will be posting tick education material on our website. We have a pamphlet called Tick-Borne Diseases in the United States Reference Manual for Health Providers. Our tuberculosis cases are concluding. We've got 2 patients that have TB. They're very compliant. They're being treated. We've chased down all their contacts. They're fine. So that's a good thing. And that, Dr. Ryder, concludes the health officer's report.
I noted that nationally there's been an increase again in COVID. Is that true in our area, or is it?
Can you answer that?
I don't have specific data on it right now just because it hasn't caught up to kind of what we're seeing in the clinic, but we have definitely seen more people coming in and getting tests, more people asking about getting tested, just kind of that anecdotal, I guess, evidence that we're seeing, but we don't have the data to back it up yet.
I know there's an outbreak at Earlham. Pete Zaleski was working with them, and we donated some tests to Pete, and Pete took them to Earlham. So they were going to test roughly 85 people that were within that circle of people that were positive.
Are you still in the wastewater program? Are we getting any feedback on that?
We do, yeah. We have that available. There's a dashboard on the Indiana Department of Health website, so we can watch that and kind of see how the trends are going there.
Okay. Clinical Director.
So Health First Indiana, there was some additional appropriations found, created, whatever. I'm not really sure of the situation. It was a little bit strange. But we got about an additional $5,000 from what we were expecting for our 2025 Health First Indiana dollar amount. So we'll kind of go over that updated budget today when we go over the financial reporting stuff. All the sub-granting contracts for our 2024 sub-grantees for Health First Indiana are coming back. They've been signed by Commissioner's Auditor's Office, our office, and they're rolling in. I think I'm maybe just waiting on one. Right now, I'm finalizing the reporting and invoicing documents for our sub-grantees for the Health First Indiana process for this year. I'm going to get those done certainly by the end of the week. And then the State Department of Health provided us with an extension on our biannual reporting deadline due to the massive amount of transition that we're going on here locally right now. There's been some discussions about opening the request for proposal soon for our 2025 contract dollars, just to ensure that the funds are available by January 1st so that we go through that whole process. However, the Indiana Department of Health provided me with some me and Dan, with some updated information recently, or clarified some information recently, that the requirement of SEA 4 for the 30-day posting for contracts is that the agreed upon contract is posted for 30 days. So the way that it had always been interpreted to us, and I'm certain that I have it in a PowerPoint, is that the request for proposal is posted for 30 days. But what was clarified to me last week is that it's actually the agreed upon contract for how you're going to sub-grant your dollars, or whatever sort of contract you enter into, that has to be posted for 30 days. So I actually had the chance to talk to the Health First Indiana attorney, and what she suggested, since we've already entered into contracts, is that we post our signed contracts so that there's no sort of impression that we're trying to be deceitful in any way, and that it's still perfectly fine to be retroactive reimbursement to June 1st. And she said consult with your county attorney also, but she said that is, if it were her client, that's the legal advice she would give to her client. So maybe something to kind of be thinking about is the request for proposal process for 2025, so that we kind of have everything in line by that time. Do you have anything you want to say about that?
No, I think that covers it.
Okay.
We did what we understood the process to be, and it turns out that they interpreted it a little differently than we did.
Yeah.
So I don't think it's a major issue.
I talked to Dan a little bit at that meeting, and I got the impression also that you found out that we could amend a contract and then post it for 30 days without actually having to go through the whole submittal process again.
Yes.
Is that correct? I understand that correctly.
Yep. Yep. As long as it's posted for 30 days for the public to view, we can expand, amend, kind of however we want to do it. So, it's kind of cool. Does anybody have any questions about any of the Health First Indiana stuff?
I guess, what does reimbursement look like for ones that are in it now?
So we have a set dollar amount for 2024 for reimbursement. We have a set dollar amount, sort of. I guess it's not technically set, it's draft right now. For 2025, both the document for data reporting and invoicing is almost finalized. The auditor's office, I want to sign off on the invoicing document before I officially send it out. But really it's just a few tweaks from what the state uses for their invoicing document. And so that's Friday's my last day, so it has to be done by Friday. So I want to make sure that it's solid by then. but everybody will have that by Friday for sure. Okay, so financial report, that's the one that's blue on the top and then alternating gray and white. Should be right after your health officer's report in the folder. And I'm not gonna go over this one in detail, but I do want to give you a chance to look over it and see if you have any questions. And just to preface, we are gonna go over in detail the Health First Indiana versus the county budget for 2025. Anybody have any questions about that document? Let's skip ahead to this document, this kind of multicolored blue on the top. At the top, you'll see 1159 County Health Fund. I'm not going to go over this one in detail, but I did want to summarize to you all to the board the changes in appropriations that are being done to correct some issues that have happened over time in our accounts due to things accidentally being charged to the wrong fund, or maybe, for example, our safety pin grant during the last cycle only reimburses $30 per month per person, and the claims that were submitted were for $40 per month per person. And so what happened over time is it became negative about $2,000, and so what we have to do is we have to move that $2,000 to another account. So this whole sheet is a summary of all of our active accounts, what their original appropriations are, what's been spent in those accounts, and what new appropriations, if any, are going to be happening. For the most part, the appropriations are only changing if there's large amounts of cash that has not yet been appropriated. There aren't going to be appropriations that were originally done and then changing, if that makes sense. All the red are ones that were negative or incorrect for one reason or another. And then I tried to put notes over in the right-hand side what I was doing to kind of resolve those issues. And our financial reporting system was last fully updated as of the end of May, and so that's where these numbers are coming from, the end of May.
Okay, and this has been cleared with the auditors?
Oh yeah, the auditor, this is the auditor and I project together.
Okay.
This has been a long project, so we've been working together.
So
on
this
a long
then
time.
takes care of all the accounting errors or?
Yeah.
Okay.
It's not quite finished yet, but I wanted to kind of provide you with a summary of what's being done. There's a lot of paperwork that has to be done to make all these changes.
I'm sure.
Okay. The next one that's got blue and orange on it is our summary of our 2025 Health First Indiana and County Health Fund. So we presented our 2025 County Health Fund budget to the County Council at the County Council workshop last week. Is that right? Yes. Last Wednesday. And because of the way that we're kind of changing the structure of the fund, they asked that next month at the County Council Finance meeting that we present the two budgets side by side, just to show that we're covering every account that we usually spend money out of. So what I have here, you'll see there's a 2025 section that's got the two funds side by side. Then the blue one kind of over on the right hand side is the Health First Indiana 2024. And then if you go on to the next page, you'll, just maybe maybe not. It may not have printed exactly the way it was supposed to. Well, regardless, we can look at the 2025. So what you'll see is that there's grayed out in one section or the other, either the 1161 section, which is the blue section, or the 1159 section, which is the orange section. So we're accounting for every account line that we typically spend money in one or the other of the two accounts. And then, for example, if you look about midway through the first page at the account line where you see both sections grayed out, there's a note in the middle of the page that says when 2025 budget was submitted, executive director position was not happening. So in those cases, there may need to be changes that are made, or there's other cases too where the number changed or something like that. So you might see where both are grayed out for various reasons, but I tried to make notes in every case so that you can see what's going on. With that being said, something that needs to be discussed is that this was originally due on June 15th. So when that was the case, there was a little bit of a different leadership hierarchy at that time. And so I suspect that things may change between now and when this needs to be officially submitted for the next conversation in August at their finance meeting. Do you want me to add back in the executive director to this account where all the other personnel is? Okay, I can do that. One of the other questions I have is, when I submitted this budget in June, I submitted it with the clinical division assistant, which is one of the job descriptions we recently sent off to Wagner, Irwin, and Shealy. Do I need to take that one out of the 2025 budget, or is that going to stay in the 2025 budget? Or is that a conversation you want to have later on?
I think that's something we still have it firmed up exactly how
Okay.
we want that. The question is that we made a change when the budget first was out. We weren't going to have an executive director. We were going to have a clinical director and an environmental director. Since then, we've decided that we need to have an executive director. And when we didn't have an executive director, it was talking about having a clinical assistant. So now that we're saying we think from an organization we need to have an executive director, there's a question of do we need the clinical assistant? And I think with all the grants going and everything we're doing, we're going to have to sit down and just look what makes sense. And that position might be eliminated, or it might be decided that we do need some assistance in another area. So that's something we're going to have to take a look at.
To give you just a little bit of background or maybe deciding information to kind of keep in your mind as you're considering these things, maybe the second to last page. I don't know, this printed strangely. So last year, 2024 County Council gave us $827,000. As of right now, we've asked for $787,000. So it's significantly less than what they awarded us in 2024. The reasoning for that is because of the increase with Health First Indiana. However, if we added the executive director back in, it would be just over what they awarded us last year. Then if you take out the assistant, it would be lower than what it was in 2024. So just kind of some numbers to keep in your mind. The other option that I've kind of mulled over in my mind is if you decided to take the clinical assistant out of the health fund, you could always put that person in the 340B fund later on. So just maybe some options to consider as you think through these different things.
There's no restrictions on that in terms of who goes in?
No. The only difference is with this budget, when they're in the county health fund, there's assistance from county council and the commissioners with the various benefits
Right.
that are provided for the employees. If they're in the 340B fund, that's all us. And just to kind of provide a summary of that additional $5,000, I wanted to make sure that we had plenty of cushion with the legal fees for 2025, which is something I think we discussed when we were doing the 2025 budget initially. And so that's really where that money was put. Do you want to look through that, or do you have any questions on the 2025?
Just the two, I guess there's two pink items that are being
Yeah.
decreased. What's
Okay,
the-
so the
what's the rationale behind that?
pink
or-
ones, just in case any numbers need to be changed, if they requested, like, I think you're asking for too much here, for example, I made some of these pink
Oh,
because I
okay.
thought, okay, this is more than we've really needed in the
Okay,
past.
okay.
If you look over, like, the very first one that's pink is the 33230, travel, lodging, and meals.
Mhm.
If you look over to the all blue section,
Right.
10,000 is what we requested for 2024, and we've only spent $119 so
Okay.
far. So that, I just made it purple to draw attention to, I
Okay.
really don't feel like we need that much. That's somewhere where you could decrease if you needed to.
That said, we're gonna just spend about $4,000 for all conferences.
Okay, Dan said, with that said, we'll be spending about $4,000 for fall conference, so just kind of some things to consider. Still a good cushion there. We also have that account line appropriated in other accounts too. So maybe just as the year plays out, something to think about. We typically budget for about $25,000 for legal fees, and I did increase it to $50,000 for 2025 just to have plenty of cushion, which will be relevant here in a second when we talk about legal stuff. Any other questions on these? Safety pin funding. So safety pin is where we were going to subgrant one of the partnerships that we have. The Health First Indiana Department of Health director had some questions about that process, and so did I. So I went to the department director, who didn't get back with me for about 8 weeks. I'm not really sure why. So they instead decided to go to the Deputy Health Commissioner of Indiana Department of Health, who suggested a contract revision. And I pushed back on that a little bit because I didn't feel like we needed a contract revision because we already had the account line appropriated that we needed in order to subgrant that funding. And Birth to Five's proposal aligned with our original proposal for that funding. So essentially the process went round and round a little bit, and currently the clinical director for Health First Indiana is talking with the Deputy Health Commissioner to ensure that we can still use our funding for subgranting for Birth to Five. However, if we can't, we still have plenty of money in our Health First Indiana to subgrant because we didn't award all of it for 2024. They met yesterday, so I think I should find out soon if there has to be a contract revision in order to do that. Even if there has to be a contract revision, we can still do the subgranting. It may just take a little bit longer to get the reimbursement to them, so we may have to reimburse them out of Health First Indiana first, and then come back and do safety pin later on.
Okay.
Basically, the administrative staff at Health First Indiana said they opened a can of worms they never should have because they agreed with me that there was no issue to begin with, but I'll just leave it at that. Okay.
Now, we were doing some other grants. Did we have any trouble in those
No,
areas?
that's cash sitting in our account, and that is no longer regulated by Indiana Department of Health, so that's sitting there for us to use as we please. Okay, so then we have 2 legal invoices in your packet here. So the first one comes from an email from Ron Cross, and at the subject line it says, I'm not sure how to say this. Do you know how to say it? Defer Varan invoice.
Yeah, sure.
Do you want to talk about this, Dr. Ryder, or do you want me to?
You're talking, okay. I'll talk about it briefly, and then you
Okay.
can add it. Basically, in negotiations with the jail, on starting the hepatitis C
Yes.
treatment program, the questions arose as to the legality and how it could be done.
Right.
And so finally, it was decided the best way was to get an outside independent opinion, which the county did. And so the bill has come through, and basically the county, since it pertains to what we're doing, that they've asked would we pay the fee. And I think it would be out of the 340B money.
It could be, yeah.
So I think it's, my feeling is it's reasonable, since it pertained to us and about our activity, that it would be reasonable that we pay the fee.
Do we have something in our packet on that or no?
Yes.
Oh,
You have the invoice available.
That's a bit.
No,
okay, sorry. Okay, I'll keep looking.
it says Ron Cross at the very top. You can have
Okay,
it.
I'll look for it. All right, sorry about that.
Okay, so
All of yours.
we need to do this, why? I'm confused. It's one
Because
part of
we
county
want-
The
government.
bill came to the county.
Okay,
The county has asked that we pay it because it pertained to activities
okay,
of our department.
okay.
So, I guess part of the question I have is, did this engagement with this legal service provide us the questions or answers we needed?
Yes.
And are we gonna be able to do the hepatitis C testing in the jail?
I don't know, it's up to the sheriff.
Okay,
But it cleared up the legal issue.
okay, great.
But it still hasn't, but there's other issues,
Okay.
but it cleared up the legal issue.
Okay. Okay.
It was significant and extremely helpful.
Yes.
It's a question we've had for a long time.
Okay.
Made me feel more comfortable kind of moving forward with.
Right,
some stuff
right.
like that. And I will mention too that we haven't touched our legal fund in our county health fund yet, or we haven't touched our legal account line in our county health fund yet either, which has $25,000 appropriated.
Okay.
So we've got $25,000 set aside for legal. Why don't we just pay it out of that?
20,000 of that is to pay your attorney.
Okay, I'm sorry, maybe I don't understand fully.
Yeah, 'cause we got.
Our county attorney,
Correct.
the services for,
Yes.
okay,
Okay.
The
So-
health department's attorney.
yes.
Yes.
So
Okay.
there are two contracts, one for the county attorney, one for the health department's attorney. It happens to be the same person, but
Okay.
it's set up so that,
Okay.
and for whatever reason, that payment that's supposed to come from the health department has not happened yet,
Okay.
but it will be corrected.
Okay,
Oh,
my mistake, sorry.
So there's 25,000 in that, you said, but 20 of it is
going.
Is all-
dedicated.
Is for your
Yes,
attorney.
okay,
Well, we've got 857,000 in the
right.
340B fund,
Right.
so
We've got
we
plenty.
can cover it.
And it
Yes.
really pertains to 340.
Absolutely, yeah. Do you need a motion to
Yes.
approve?
Like a motion.
I make the motion to approve.
I'll second.
Other questions? All in favor?
Aye.
Opposed? Motion carries.
Jeff, I have a question for you, so on this legal issue. So the we have $25,000 allotted in 1159 for legal fees. 20,000 of that is essentially a retainer for Ron. We also just received an invoice from Ron for a little over $6,000. So does that come out of the 20,000, or is that going to send us into the hole?
Haven't seen it, so I don't know.
And I guess this means that it's over and above what his contract calls to do under the $20,000.
I would expect.
Yeah.
But again, I haven't seen all the details. One of the reasons that there was a suggestion to increase the legal line was that there has been more activity on houses that,
Mhm.
need to be designated as uninhabitable, and the legal side of that costs money. So
Right.
that's why I think the number doubled for next year to allow for increased enforcement action.
So what is this, like a estimated number of hours? Is that kind of how this number came about? You know?
Came from
History?
the health department's attorney.
Are you asking about Ron's bill, or are you
Yeah,
asking?
well, actually both, I guess.
So Ron breaks his down by the service description, the
Yeah.
rate,
Right.
and the hours.
But I guess the $20,000 is it like
That's
estimated of 400 hours X, or, I mean, how do you arrive at that $20,000 to begin with, I guess? And I'm just trying to balance what this means in terms of what's considered over and above. You know, I'm not questioning it per se, except I just, would be nice to know what is the expectation.
I think I can speak to it at least at some level, although I don't
Okay.
have, I mean, I don't have the documents in front of me. My understanding, so for the first part, the 20,000, the retainer is essentially for services that he's going to perform, you know, throughout the year. And that is based on an estimate of, you know, traditionally or historically what he's needed to do in the past. The additional invoice that's come in is exactly right. It was for the additional enforcement actions. And the reason that came in as a separate invoice is it's beyond the scope of the contract for the services that he provides as the health department's attorney. That wasn't provided for, so that's why it's over and above, you know, what was originally appropriated.
And then this other issue dealing with our past director, I think.
Right.
Yeah.
That's
That
what-
as well, and I think that, I don't quote me on that because I haven't talked to Ron
That's what
specifically
this
on that, but I
bill-
believe that is a number of those hours as well.
This bill has nothing to do with unfit housing or anything
Yeah.
like that. This bill is for that particular issue.
Solely for the
Correct.
HR issue.
So any of those, I guess, to then follow up on this, so any of those, what do I want to call them? Personnel matters or extra court kind of things, those things would be billable beyond what's included in the $20,000.
I don't want to speak for Ron on that because I don't know, and I'm not completely familiar with the terms of his contract, so I can ask him and ask him to get back to you.
So I think I had a conversation with Ron last week, and I believe the $20,000 is our enforcement actions are within the scope of that $20,000.
Okay.
When we do unfit housing and
Okay,
things
well,
like
that's kind
that.
of where I was going
So
here.
that's why we don't have a bill for unfit housing. This is beyond the scope of the
Okay.
20,000 as
Okay.
far as the personnel issues.
That makes sense. based
It's
on what you
possible
said,
that's
yeah.
entirely right. I may just have that backwards, and that's why I kind of was hesitant to speak, but I want to make sure I give you correct information.
Something maybe to consider, just kind of moving forward, is that we bring income into our county health fund as well. And our income right now is more than or about equal to already what our entire income for 2023 was. So it's realistic to think that maybe you could advertise appropriations to increase the amount for legal fees if necessary in the county health fund. But I don't fully understand that process, I'll be honest with you, and that's something that you'd probably have to talk to council and the auditor's office and things like that.
Well, irregardless, we need to pay this one.
Right.
bill. It sounds like the bulk of it could come out of the rest of that. It would be that 5 that's left from the 20, and then
Mhm.
that would come up with 1,600 out of other funds.
Do we need to designate where it comes from, or just to pay?
No, yeah, you'll have to designate where it
Yeah.
comes from.
Do you have any recommendations where it comes from?
340B would also be
340B,
fine, yeah.
That's where.
I would make that motion then.
Second?
Second?
All in favor? Opposed? So 5 comes out of the legal fund and the rest comes out of 340B.
staffing updates, Dan did turn the request to hire for the executive director in to Human Resources last week. Do you want to talk about the FEMA coordinator interview?
Yeah, so we had a person apply for the FEMA coordinator's position, and according to the job description, her application resume didn't quite fit it, so we contacted the state, and they said experience definitely substitutes for formal education. So we got with HR, confirmed it with them that the job description would not have to be changed. They did check with Irwin, and Irwin agreed it did not have to be changed. So we set up an interview for next Tuesday to interview this person for the FEMA coordinator position.
As far as program updates, the main thing I just wanted to talk about is the Start Smart campaign is about to start. So what that is every kiddo that is on some sort of managed health care with Medicaid gets a letter sent to them that you're going to be due for some kind of shots before you start school. So those letters went out about 2 weeks ago, and so we're going to start getting kind of a flood of kiddos that need immunizations soon. So we're kind of trying our best to tack on to any sort of programs that we can to get immunization events scheduled, and then doing our own regularly scheduled immunization events, Saturday clinics, things like that. So that's the Start Smart campaign. And then the final thing that I have in the miscellaneous category, well, 2 things from me, 1 thing from Dan. Reed has requested our consideration for sponsorship for their Overdose Awareness Day. And that sponsorship can be anywhere from, I believe it was $500 to $15,000. Yeah, so kind of a, yeah, $500 to $15,000. It's a suicide walk sponsorship. So kind of I asked for some formal information. I don't have that yet, but my understanding of how that works typically with different walks is like however many laps is a certain dollar amount, things like that. So that's something that I wanted to bring to the board for consideration. And then the other one, the other sponsorship for your consideration, you have a paper at the very end of your folder. So I think it's the second to last page in your folder. For Meridian Package. This was something that was done last year. I know Christine had done this. That's why there's a 2023 partnership up above the 2024. This wasn't something that I really felt comfortable committing to, or I wanted to bring it to the board to discuss and maybe make a decision on. I do have more of a lengthy packet that kind of talks about all the various pieces that are included in those bullet points. It's like 20 pages long though, so I didn't want to print it, so I can email you the packet if you want to take a little bit more time to think about it.
And what do these 2 programs accomplish?
So the City Fit, which is the first bullet point from 2023, has been renamed to Fit Fair, which is the first bullet point in 2024. And I know last year we did mass immunizations at that event. However, this year they're not doing that. They're not doing immunizations. So in my opinion, that's a little bit less advantageous for us, because right now is our immunizing season. Yeah.
Okay.
Flulapalooza, the third one down, I think that that's a good time for us to get out there and get flu shots. Then the other ones, I think it's just more about publicity and getting our name out there and things like that, not as much about actually getting vaccinations or STI, STD testing, things like that. But I can send you the full packet that has more information about each one of the events. I don't think that it's necessary to do the full package either. We can kind of pick and choose if that's something that you're interested in.
So the one that you're saying is the flu, Lapapalooza is the one that you think. And the others would just be a sponsor.
Yeah, we are going to the Fit Fair, and that's a back to school event, and so we've got school supplies that we're going to have at our table, and so we are participating in that event.
And the speaker series, what's that?
So it's school assemblies. My understanding is they bring in different speakers into the schools to kind of teach the kids different health-related things, mental health, physical health, where different resources are, different tactics for various types of health. And it would be us kind of sponsoring or supporting that programming.
And to give kids a smile.
I think that's a dentistry program. And it's... Meridian Dentistry, dental oral exam, educational, preventive, restorative services. Offer the services free in Richmond. So probably just helping to support the programming to continue it to be offered free.
That's certainly a need.
Mm-hmm. Yeah, and there's different, the one that they asked us about was...
This would come out of what, 340B money again?
I think because it's so school related, it could be the COAG, which is the one I said is just sitting there. We can kind of choose how we want to use it. And it does, the one that they've asked us about for the Give the Kids a Smile, I think is the $1,000 one, which has e-blast, web, social media marketing, recognition in press, logo on back to school page reaches over 5,000, and logo on event flyers. So they're not even asking us for anything physical to help support that. My guess is we are supporting the program continuation though.
But I think they all address worthwhile public health issues.
Yeah.
I say if there's enough money, you just do it all.
Do it all? That motion that we fund all.
How much is the total fund?
8. Oh, and the 640.
Yeah.
6,400 for a multi-event discount.
Yeah.
The money's just sitting there.
For a second?
I'll second.
Okay. Further comments? All in favor?
Aye.
Aye. Opposed?
I don't know where to, I want to bring something to y'all's attention, speaking of 340B.
Okay.
Our primary pharmacy has always been Sterling, and Phillips was our backup drugstore. They didn't want to do the program for 340B because they didn't want to carry the inventory. Well, Sterling is currently unable to fill our prescriptions because the state argues that they're not a brick and mortar drugstore. So they've been sending the prescriptions to Phillips to be filled. Well, Phillips is charging us $1,200 more per prescription than Sterling did. And they seem rather firm on that, in that regard. Now, one of the drugstores we added to the list when we were applying this program was Medicenter. Medicenter is a collection of rural pharmacies. I think the company that owns all of them is out of Chicago. They have a pharmacy in Cambridge and one in Liberty. So they had asked to be our pharmacy before. If we hire Medicenter, Sterling has got all their lawyers over at the state arguing that the state said they'll pay Sterling, but at a much reduced level, Medicaid basically. So they're over there arguing, and God knows when it will be resolved. In the interim, we can go to Medicenter and recapture the $1,200 per prescription. As well, Medicenter will do the same thing that Sterling did, which was pay our Medicare bill for us, and then we'll get the profit, which before we installed that, it was a headache dealing with the auditor because we would end up like $150,000 in the red, which made him go crazy. So I guess what I'm suggesting is that we adopt Medicenter Pharmacy as our pharmacy, while Sterling is, and we may keep them, but certainly I want, that $1,200 normally came to the health department. So I don't know if you want to vote on that or just want to give me your counsel or what, but I wanted to bring that to everyone's attention.
So what's involved in making the change?
We'll just tell the Medicaid that that's our pharmacy.
I'd entertain a motion.
So moved.
Second, yeah.
I know that when we add an additional pharmacy, it does have to be added through HRSA, and that process takes about 6 weeks, so I don't know if Dave's started that yet.
It's already been added.
Okay.
We did it when Christine was here. I couldn't see any downside to adding them. You know, you could have 10 drugstores. I think the more you have, so they're already on there. So we could flip the switch.
All in favor?
Aye.
Opposed? Okay. Anything else on program updates or miscellaneous before we move on to Dan?
Do we want to kind of put a pause on the Overdose Awareness Day sponsorship with the walk at Reed? I can send you some more information when I
want
have
some more
it.
information.
Okay.
I'm
All right.
curious, is this the same, is this Out of Darkness that's happening every October, or is this related to overdose?
It's in August.
It's in August, so it's Overdose Awareness Month. Okay.
But I can
yeah.
get more information and send
Okay.
it to you.
Okay, but when do they need the money if we decide to do it?
Oh,
I don't know. I can send you that information too when I get
okay.
it.
Well, if it's based on pledges, it'd be after the event then, right? Isn't that what you said?
I've asked for more information, I just haven't gotten it
Okay.
yet. All right,
Well,
Dan, you're up.
we'll wait more information.
For your Percy program, and I have one more thing to say.
And,
No.
yeah, I would be interested for Centerstone as well, so
Okay.
if you could share that information, maybe Neighborhood Help as well, we would like to know more about it.
Okay.
I attended a meeting yesterday with Firefly and a few other representatives, one of those being Richmond Police Department. And they're part of a program, they're calling it Car Seat Connection is what they're calling it. And essentially, a certified technician would inspect a car seat and determine whether it's expired, whether there's any flaws in it, whether it's safe for the child, whether they're properly secured in the vehicle, a bunch of different things. They're putting on an event in September. Back up just a bit, that Richmond Police Department is applying for a grant, but they can't apply until October. So they're asking for help for the September's event, and I had them draft an MOU, a memorandum of understanding, for us to get involved and offer them some money to put on that event.
Now, how does this affect the people who don't live in Richmond?
The event would be publicized through several different agencies. Firefly, they have an office here. They're actually located out of Connorsville. And there's another agency that this was an hour meeting yesterday, so I'm not too up to date on it, but it's like an umbrella thing. There's an agency out of Hancock County that is the major umbrella, and then Firefly and then the RPD all fall under that umbrella. So it would be advertised through all three agencies. And as far as the county goes, I spoke to someone this morning, a commissioner, and they asked if they posed the same question. So I put the commissioner in contact with the umbrella company out of Greenville, or it's Greenfield over there. So to ensure that we could reach the smaller communities, but that's in the infancy stage. He's not got back with me. So I'm assuming if it's wanting to expand county-wide, we would go through the normal process of this board and then the commissioners and so forth, so on. And then the sheriff's department or some other agency would have to have 2 certified technicians to actually operate a program. So those technicians would have to be certified before we could branch out. With that said, if RPD as the officer that is a technician, or both of them, they can go anywhere. They can go to Cambridge City, Hagerstown, Greens Fork, and perform the same duties. And also the umbrella company out of Hancock County will also send technicians your way, because those technicians need continuing education credits So they're willing to travel to do these events so they can keep their education up.
Okay, so how do people know about the pizza? They publicize the event, or how?
So they go through Birth to Five, they go through Firefly, they put it on social media, advertise it on the radio, they put out corrugated signs. Reed Hospital will advertise because they also have a certified technician at Reed Hospital. They were part of the meeting as well. Yeah, all the agencies involved with after we'd put it on our social media pages. And I'm sure old Mike here will put it in the paper too.
And as you say, it addresses one of the needs that we're supposed to be addressing, is correct safety and
Trauma and injury prevention.
trauma injury prevention.
There's also a bilingual technician on site
cool.
too.
My question was around funding of this. I mean, are we buying a surplus of car seats, or will this be, they'll send us a request for X amount of dollars?
So my intention with the MOU was to just give RPD X amount of dollars. I was thinking $3,000.
Okay.
And they could use that to not only purchase car seats, but there's, it's been a long time since I've had a child that young, but there's evidently placards now that you can put on a car seat that has all the child's biographical information, medical, in case the parents are deceased in an accident, it has the next of kin or guardianship. There's little placards like that, so they're wanting to purchase that, they're wanting to purchase car seats. And not every person that shows up qualifies for a new car seat. They have to be financially in need of that, and they have to prove that in some form or fashion. I don't know what that process looks like, but that's what it was explained to me.
But they could bring their car seat to see if it's fitted properly.
Yeah.
Correct.
Person could.
Yeah.
It's not only for replacement, but it's also to ensure that the
Yeah.
child fits the requirements for that particular car seat. Are they too big, too small?
Yeah.
Are they secured properly in the vehicle? You know, it's not just a replacement of car seats or giving things away.
Right.
It's also an education opportunity.
I move for approval. You said $3,000 is what? or-
That's my intention, yes, that's my.
I second it.
Second it. Okay, any further questions or discussion? All in favor?
Aye.
Aye.
Aye. Opposed?
Oh, I forgot to say 340. Is it 340 B2?
Where's,
At this point, I was gonna, there's several options.
there really is, isn't there?
Yeah.
Because I think this would fit several of our,
With an MOU in place, as long as the commissioners approve it,
Mhm.
we can pull it out pretty much any contractual.
okay.
In our health maintenance carryover request, we put a line, we put $80,000 for contractual professional, and the note was to support Health First Indiana KPIs and linkage to care. So I feel like that would be an appropriate use of that funds. We haven't touched it yet,
Yeah.
and it's $80,000 for this year.
Yeah.
The goal is too that they get approved for their grant, and that, you know,
Right.
at that point, we
Yeah.
become, we can still support, but they'll be the
Support, but
primary.
not have to fund it, yeah.
Okay, you ready for Dan for the SOPs?
Are there any questions on the SOPs I submitted to you, or any of the programming?
I just wondered on some, I could find out where it looked like there was an appeal process, but on others I didn't. Do they need to have an appeal process for some of those, or?
Some of the policies that were internal for our staff only, so those would not have an appeal process. The other ones were for programming, for housing, septic, you know, things like that. So yes, if we were to write a violation and that property owner was in disagreement with us, then we would allow them per statute to appeal our order, and we'd have a timeline in there before enforcement began.
And then there were two that seemed to do with food service.
One was internal, and the other one was for the inspector. So one of the policies was for my part-time clerical person. She handles all incoming applications, permit payments, things like that. That policy was drafted for her, so she has a step-by-step guide on how to do her duty. And then the other one was for the food inspectors themselves.
Were there other questions? Then these would move on to some of these move on to the commissioners or the?
I don't believe so. They're internal policies. They
Internal
don't need to be
policies,
heard.
okay. So it's all internal. I'd entertain
I'll
other
make a
questions.
motion to approve.
Second.
All in favor?
Aye.
Aye. Opposed? Thank you, Dan.
There you go.
Well done. Old business? Well, new business. This is Becca's last meeting with us. And she stepped in at a difficult time,
Absolutely.
in a time of immense change,
Yeah,
and did well.
very well.
And so I wish you well
Thank you.
in your new endeavor, and thank you for your time with us.
Thank you.
Your service.
I appreciate that.
Okay. Next meeting is the 20th. Is there a motion to adjourn?
So moved.
Second.
All in favor?
Aye.
Opposed? Well, thank you, everyone.